Welcome to your Barbados Today Evening News Update for Wednesday, November 4. So glad you could join us. 38 people have been hospitalized as a result of dengue fever, and health authorities are urging Barbadians to be on their guard. Chief Medical Officer Dr. Kenneth George says so far this year there have been 301 probable infections and 8 confirmed cases of the mosquito-borne illness. This is an increase over last year when 92 probable cases were reported with no confirmations. Dr. George is urging the public to check their premises at least 2 or 3 times a week to ensure there are no mosquito breeding sites. He also called on anyone with symptoms of the disease to seek medical attention as early as possible. Symptoms include fever, headache, pain behind the eyes, muscle and joint pain, and a red, itchy rash. In other news, Barbados must open more avenues for local sex workers to better receive health care and other forms of support. That's the call of Cecilia Neblett-Murray, behavior change specialist at the HIV/AIDS Commission, as she spoke at a workshop entitled Reviewing the Steps in Implementing HIV/STI Programs for Sex Workers, which was hosted in partnership with the Women Empowerment Movement today. In her address, Neblett-Murray said that because HIV/AIDS numbers are predominantly seen among sex workers, more should be done to help protect the vulnerable group.
These are the 3 pillars that we're focusing on: the access to care, treatment, but we're also looking at partnerships. We want to maybe go into the welfare department, maybe go into the National Assistance Board, maybe go into the Ministry of Education, maybe go into the Ministry of Labor to advocate on the sex workers' behalf that we're taken seriously, so that they can be given all the appropriate programs available, resources available as all the other persons in our public space. We're also focusing on understanding the sex work and its links with HIV.
The government of India today donated $100,000 in medical supplies and personal protective equipment to the Queen Elizabeth Hospital to assist in the fight against COVID-19. Speaking at the presentation, Honorary Consul to India Dr. Mohini Harris said India was pleased to be able to assist Barbados during the pandemic. Reading a message on behalf of the Government of India, Assistant to the Honorary Consul Safia Patel said India is currently working on a COVID-19 vaccine.
We are happy to see that the spread of COVID-19 in Barbados has been contained under the dynamic leadership of the Honorable Prime Minister of Barbados, Ms. Mia Motley. India remains committed to supporting its friends and is happy to contribute by way of extending technical assistance, medical supplies, and protective gear worth US $100,000 to assist the government of Barbados in its fight against this pandemic. This gesture is a symbol of solidarity and the strong and friendly bilateral relations that exist between India and Barbados.
The Hospital Director of Support Services, Louise Bob, welcomed the donation.
This donation of PPE and medication will redound tremendously to the fight that the government of Barbados is enduring with wrestling down the pandemic, and for ensuring that we continue to keep our people safe, our staff safe, and the hospital, which is our only public secondary and tertiary medical facility, free of and safe from the coronavirus.
In today's COVID-19 update, a 33-year-old Barbadian male tested positive today out of the 464 tests conducted by the Best de Santos Public Health Laboratory. The male, who was asymptomatic, tested positive on his second test after arriving in Barbados on American Airlines on November 1. No one was released from isolation today, so the total number of confirmed cases now moved to 239, 126 females and 113 males. Those in isolation number 8 and 224 persons have recovered. The laboratory has completed 37,546 tests since February.
There's regional and international news after this short break.
Barbados Today, news you can trust.
Welcome back to regional news. As the Christmas season approaches, Grenada says it will ramp up testing for COVID-19. Authorities are, however, urging citizens to act responsibly and to stay clear of high-risk activities to prevent any surge in new cases of the viral illness.
As Grenada and the rest of the world get into the Christmas season, the Ministry of Health will be further stepping up its domestic testing to confirm the local epidemiological situation in the country's fight against COVID-19. Minister of Health Nicholas Steele says in finding a balance between health and livelihood, the officials will ensure that the hard work of keeping the virus at bay in Grenada does not go in vain.
As the Christmas season approaches, we are very much aware in the ministry that it's seen as a period of or a season of festivity, of gatherings, family gatherings and gatherings with friends, of fetes, of parties, of celebration. I do ask the Grenadian population to maintain a certain level of discipline in this period. We would hate to know that in our celebration of the birth of Christ, coming together to appreciate, if not recognize and celebrate our accomplishments for the year, that we were to throw it all away.
So far, officials have not found any evidence of community spread of the virus, but to be sure, increased testing needs to happen.
Quite possibly, where activities are found where persons are non-compliant, then everybody there would be tested as well, just as an additional precaution. If they are the ones carrying out high-risk activities, they are the ones probably that may get infected, as well as the wardens stepping up and doing further, more aggressive enforcement of the rules and regulations. But at the same time, the ministry's team stepping up to approve those who apply and are able to be compliant to have activities. It must go hand in hand. It is not just a simple case of no. It is to accommodate as best as possible, because as I have said previously in this very house, we must find the balance between health and livelihoods, between saving lives and maintaining livelihoods.
Since March, Grenada recorded 29 positive cases of COVID-19. Blossom Alexis Welsh, 6PMN News.
On the international front, Democrat Joe Biden said today he was headed towards a victory over President Donald Trump in the U.S. election after claiming the pivotal Midwestern states of Wisconsin and Michigan, while the Republican incumbent opened a multi-pronged attack on vote counts by pursuing lawsuits and a recount.
Get ready, everyone. We are getting into that scenario where we may be counting this election for days. At this point, we see that Joe Biden seems to have won Arizona, or is trending in that direction. Donald Trump has carried the Sun Belt. He's won Florida. He has likely won Georgia. He seems very close to North Carolina and is trending towards a win there as well. So what do we do at this point? We're focusing in on the Rust Belt. We're talking about states like Wisconsin, Michigan, Pennsylvania. Those are states that we've been looking at closely for quite some time. The polling shows that Wisconsin and Michigan are trending towards a Biden win, but really this election is really going to come down to what we expected, Pennsylvania. This is a state where we're still seeing maybe 3.5 to 4 million votes still have yet to be counted. Many of these are early or mail-in ballots that could take days to finally count. Our exit polls are telling us that President Trump is doing about as well among most major demographic groups in that area than he has in 2016. But we do see that he is about 5 percentage points lower among college graduates in Pennsylvania, specifically 5 percentage points lower among white college graduates. Trump also is about 9 percentage points lower among young voters in Pennsylvania between the ages of 18 and 44. However, it's important to note that we also see that Donald Trump is doing a little bit better, about 3 percentage points better among older Pennsylvania voters. Those are voters who are about 45 years old or older. So in Pennsylvania, we also know that there still are millions of votes left to be counted. Most of these votes are mail-in votes. They are early in-person votes. And we know from Pennsylvania what they've told us that it may take days to actually count some of these votes. We also know from pre-election polls that a lot of these early and mail-in voters tend to lean Democratic. They tend to be Biden supporters. So what you're going to see in the state is Trump ahead in Pennsylvania, but that lead is going to slowly evaporate. That's what we call a red mirage, a strong lead for the Republican that seems to get smaller and smaller and smaller over time. And that's going to happen over the course of days as we count Pennsylvania.
That's news, but for the very latest, visit our website at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media and bus terminals, as well as screenplay at supermarkets and gas stations near you. You can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.